trauma is classified based on the mechanism of injury and the extent of bladder damage. The American Association for the Surgery of Trauma, AAST grading system, is commonly used to categorize bladder injuries. Management depends on the severity and type of injury. AAST grading of bladder trauma. 1. Grade 1. Contusion or intramural hematoma, microscopic hematuria. 2. Grade 2. Laceration 2 centimeters of the bladder wall, extraperitoneal. 3. Grade 3. Laceration 2 centimeters of the bladder wall, extraperitoneal. 4. Grade 4. Intraperitoneal bladder rupture. 5. Grade VA. Laceration involving the bladder neck or associated with avulsion of the ureterovesical junction. Management of bladder trauma. General approach. Initial stabilization ABCs. Imaging with contrast-enhanced CT cystography or retrograde cystography for diagnosis. Management by grade. 1. Grade 1, contusion. Conservative management. Observation and catheterization if needed. 2. Grade 2, small extraperitoneal laceration 2 centimeters. Conservative management with Foley catheter drainage for 7 to 14 days. Repeat imaging before catheter removal to confirm healing. Grade 3, large extraperitoneal laceration tan 2 centimeters. Conservative management with catheter drainage in most cases. Surgical repair if there is bone fragment impingement or associated injuries. 4. Grade 4, intraperitoneal rupture. Surgical exploration and repair. Layered closure of the bladder defect with urethral catheterization and suprapubic catheter if necessary. 5. Grade VI, bladder neck or ureteral involvement. Immediate surgical intervention. Repair of bladder neck injuries may require complex reconstructive techniques. Ureteral reimplantation may be necessary if the ureterovesical junction is disrupted. Special considerations. Penetrating trauma usually requires surgical repair due to associated injuries. Pediatric bladder trauma, managed similarly to adults but requires special attention to growth considerations. Pelvic fractures with bladder injury often involves extraperitoneal rupture. Evaluate for concomitant injuries. Follow-up. Imaging post-treatment to ensure resolution of the injury. Urodynamic studies in severe injuries to assess long-term functional outcomes. Timely diagnosis and appropriate management are critical to prevent complications like infection, fistula formation, or long-term bladder dysfunction.